Calcemia, the priority is to get calcium levels up quickly and safely. This usually involves giving calcium intravenously IV calcium. Typically, it's calcium gluconate, usually a 10% solution, given as a slow infusion.
Slow infusion, okay.
Yes, giving it too fast can be dangerous for the heart. If the symptoms are really severe or persistent, a continuous IV infusion might be necessary for a while. And crucially, you need constant cardiac monitoring, watching the ECG because of that risk of arrhythmias when calcium levels are changing rapidly.
Right, makes sense. Critical care.
Absolutely. But then once the acute crisis is over, or for someone diagnosed with chronic hypoparathyroidism, the focus shifts to long-term management.
Okay, what does that involve?
The cornerstones are oral calcium supplements, usually calcium carbonate or calcium citrate, taken multiple times a day.
Just regular calcium pills.
Yes, but often at fairly high doses. And, this is really key, they also need active vitamin D.
Active vitamin D again, not just the regular kind.
Correct. Forms like calcitriol or alpha-calcital. Remember, because PTH is low, their kidneys can't activate the regular vitamin D, like ergocalciferol or coolcalciferol, effectively.
Right. You have to bypass that broken step.
Exactly. You give the body the form of vitamin D that's already active, so it can directly help absorb calcium from the gut. This combination of calcium and active vitamin D is fundamental.
Okay, calcium and active D. Anything else?
Sometimes, yes.
Yeah.
Magnesium levels need to be checked and corrected if they're low.
Why magnesium?
Because low magnesium, hypomagnesemia, can actually interfere with both the secretion of PTH and the body's ability to respond to PTH. So if magnesium is low, it's much harder to correct the calcium. You need to fix the magnesium first.
Got it. Magnesium's important too.
And sometimes doctors might use a thiazide diuretic, like hydrochlorothiazide.
A diuretic, doesn't that make you lose fluid and salts?
It does. But thiazides have a specific effect in the kidney tubules. They actually reduce the amount of calcium loss in the urine, so they can help the body hold on to calcium.
Oh, interesting. A kind of counterintuitive effect there.
A little bit, yeah. And finally, dietary modifications are usually recommended.
Like what kind of diet?
Generally, a diet that's high in calcium, but relatively low in phosphate.
Low phosphate. What foods are high in phosphate?
Things like dairy products, unfortunately, can be quite high. Also, processed foods, colas, some meats and nuts.